When in an emergency situation at a hospital or any situation that requires hospitalization, it's always good to have an advocate with you. If that young lady in that viral TikTok video had not had her mother with her, I don't know how much slower things would have gone during that registration process. I mean, it was horrible with the mother there, with the mother of the young lady in labor being there. Imagine if she wasn't there. I don't know. Know that there is a law, the Emergency Medical Treatment in Labor Act. The word labor in the Act's name refers to the requirement to treat and stabilize individuals in active labor. That's the law. It's national here in the United States, just in case you all don't know that it exists, because you might need to advocate for yourself while the situation is happening, and you might have to bring it up again after things kind of settle down, if you know what I mean. But we'll talk about it a little bit more. Ladies and gents, did you all know that there's a law, the Emergency Medical Treatment and Labor Act? It's national. It covers all medical emergency conditions. The law requires appropriate medical screening exam, and if an emergency exists, you stabilize the patient, you treat the patient for pain, regardless of if they can pay or not. It exists, right? It's a national law. It's a federal law. And it applies to nearly every hospital in the United States of America. Because most hospitals in the United States of America accepts Medicare funding. But the law extends to all patients, not just Medicare beneficiaries. Okay, so let's talk about that viral video over there on TikTok. A mother filmed her daughter in active labor. That law I was talking about is the Emergency Medical Treatment and Labor Act. The Emergency Medical Treatment and Labor Act. So a mother and daughter shows up at a hospital. If you've not seen the video, they're not allowed to enter through the emergency room. They go to the front. And what we're being told is a nurse is trying to register this lady. She's asking her questions. This nurse seems nonchalant. She seems to be ignoring the labor pains, the active labor that the patient is experiencing, that the young lady is experiencing. You have to see the video to get the gist of how the nurse was behaving. But there's been a lot of advocacy. This happened at Dallas Regional Hospital. And we've got to mention the fact that there is a severe epidemic of baby mother mortality, fatalities here in the United States, specifically for Black women. It's awful. So there's been a lot of advocacy for this young lady, right, that eventually was placed on a labor and delivery unit. The mother did let us know that that was when she saw a sense of caring for her daughter. The baby was born. The baby seems healthy. The mother did mention that the baby had a bowel movement, while still in the womb. That's called meconium, the actual greenish blackish bowel movement. And you want that to happen, that first bowel movement, but you want it to happen once the baby's born. It's important that the meconium occurs, this first bowel movement occurs. But sometime, after the baby is born, I can't quite remember the time frame in which there's a concern when it doesn't happen, but because I haven't been on a baby mother unit working in a good while, but it's a problem that baby had that bowel movement in the mother, because it means that the baby was stressed. The baby was stressed. Stress was going on. And it's not good if baby does that, because the baby could aspirate. There could be respiratory and breathing issues if that baby inhales or swallows that meconium. But it seems that the baby is okay. Tests were done. In that video, you could clearly see the agony and pain of the labor. And the nurse just seemed uncaring. There was no sense of urgency. It was awful to watch. We know that the mother's water had broken. The labor pains were in close proximity. You could see and hear the moaning, the movement, and she told us where the baby was stationed in her womb, where the baby was stationed. She said, well, she didn't say it like this, but the baby was on her butt. He was in her butt. That meant the baby was really ready to arrive at any minute, and the baby did arrive. The baby arrived 12 minutes later, so we've got to do better. And remember, the Emergency Medical Treatment and Labor Act, the labor in the Act's name is referring to the requirement to treat and stabilize individuals in active labor. Thanks for stopping by, Social Nurse.